Yeah, long haul COVID and logosynthesis. My experiences are just brilliant. I cannot give enough compliments to the approach that Willem has developed. I deal with psychosomatic issues all the time, so I regard this long haul COVID as one of them. And I have a 3-step protocol that I use, which is always dealing with the metaphor of the COVID, and then with the worst case scenario, and then with several thoughts that were, let's say, stuck in the body. And once you release or relieve the psychological aspect of the disease, what remains is usually about a third of the symptoms or the issues that were present at the beginning, and body can handle that. Okay, once you release everything that is stuck and give your body a chance to heal, it will do just that. And if you're not impatient, and if you don't have unrealistic expectations, you support this process, and it's a success story from there on. What do I mean by releasing the psychological part of the disease? Well, all the people that were on respirator, almost all of them have an experience of a near-death experience, let's say, of being really scared to death, scared for their life, okay? And people who were in induced coma while they were intubated, almost all of them have some nightmares or were semi-present while being in this state. And this is all frozen energy, okay? And I can't think of a better way to release it than with logosynthesis. Then there's the, let's say, imprint of the virus on the body. And then there's all the fear of, will I ever be better? And all in this, the mixture of all this, once you release everything, the energy gets into the flow again, and again, the body heals. I think this is very important, that, there's health, then there's the disease, then there's the cure, and then there's the healing part. In this time, we tend to live so fast that we forget that after the cure, there's the rehabilitation, reintegration, the healing. You cannot just jump from the therapy into, let's say, everyday life. There is an in-between period as well, where you have to be really gentle and accepting and patient. Yeah, sometimes people tend to forget that.
Yeah, that can be hard to remember, especially when we're suffering or we're stuck in the middle of it, right? So, right. So do you have like the smell? Have you worked with people who have lost their smell as well?
Only with 2 of them. It was the smell. Yeah. They got back their smell, let's say, to about 60-70% after logosynthesis, and then to 90% in the next few months. So it was not much different from any other, let's say, consequence from the virus. Once you remove the imprint of the virus on the olfactory nerves and how the body processes this smell, and their fear of not being able to taste and smell the food again, or in one case, it was a case of, I won't smell my baby anymore, because it was a mother and the attachment was, let's say, an issue with this. And after doing some logo on this, it went away. Okay, the smell came back. Okay, the fear went away, and the body could reintegrate this olfactory pathway once more. Yeah, now while talking about this, I heard myself, this is the medical knowledge, okay? I do have an advantage here because I know how the body works and I know how the virus works. So I can guide perhaps people to on some other level than let's say a psychologist or a social worker would. But everybody has their good advantages, and this is one of mine. Let's say.
Yes, everyone comes to logosynthesis from, some people have a coaching background, some people have a counseling background, some people are more into therapy. There aren't a lot of physicians trained in it yet, so I certainly, value your contribution to the logosynthesis community. And
yeah, this is our community is really diverse, and I think this is one of the advantages that we have, that we are really a mixed group of people and can, let's say, learn from one another.